You see, now, this is a variation of the humeral bachelor manipulation, which is with a patient standing. Marco now is positioned on the same side to the dysfunction. The patient is asked to place his hand on the side with his thumb back, being aware of this point and fingers as you see in the pictures. Then, at that point, you position one hand on the anterior part and, like a ball that grabs the shoulder anteriorly, you position the other hand behind the elbow. In this case, you have to educate your patient to constantly push against the side, and you have to ask him to lock the elbow, because this will then be pushed forward. Once the patient has learned to maintain the position, you'll perform the manipulation. But how do you do that? You must lock the shoulder anteriorly and push it and manipulate pushing the elbows forward, while the patient will oppose resistance. Marco told me that this manipulation, of course, gives that typical noise of cracking, since it gives cavitation, and, in addition, it's a manipulation that you can, however, perform only when your patient is able to maintain the position without pain. This one, you see in the video, and in addition, clearly in the acute phases of severe pain, when they already are unable to maintain the position. Obviously, you're not going to do it, because it could be too invasive. Ditto, when there are real cases of hypomobility, of course, is to refrain from this type of manipulation treatment. Every time, however, where there is actually a chance to put your patient in this position and perform the manipulation with no kind of pain, then you can really go ahead to perform it. Do I make you blush when I congratulate you, even here?
Actually, no, I'm sorry. Let me add that, of course, as in all shoulder pain syndromes, you should associate them with the cervical and thoracic spinal adjustments that obviously you've already learned in the other video course.
Well, we got it, right? In the video, then, think about us, that in fact this time we're talking and you're listening to us. We are survivors after 2 days of full immersion, filming, recording all the audio that for you, maybe you saw it some time ago or you still have to access the video course on the spinal adjustments. For me and Marco, as we have just finished filming, we did that almost 2 hours ago, so we can tell you a little bit about behind the scenes, what happens when you go to make a video course of this level.
Right. So it's very important, I said, just to evaluate and treat the shoulder in a comprehensive way, to associate these two manipulations, both the rib bachelor and the scapulohumerus, to the vertebral treatments of the cervical, and especially the chest part. But of course, I tell you already that by themselves these two manipulations, in most cases, give an immediate feedback to the patient. Yes, exactly to the patient, with precisely the various diagnoses, the various painful conditions of which I'm talking, especially in the manual.
Even because Marco explained to me this morning that often it's a common mistake when a person comes to you and wants to be treated, for example, for a shoulder pain. It is the fact to direct the attention directly, of course, to the symptom that the patient at the time is telling you. Instead, it will be up to you, that you're the attending practitioner, doctor, physiotherapist, to figure out how much, of course, it may be a problem of the shoulder, and even how much, furthermore, to go to intervene in the cervical spine, in the various joints, the release to free, already from there, the problem at the root.
Right, so, obviously, this is relative to the anatomy, okay? So to the innervation that starts from the cervical spine. But you have to know that, of course. Even only these two manipulations, as I said before, peripherals, so the rib bachelor and the bachelor-humeral one, will give a significant joint release in most cases. And of course this you'll need to test it through precisely the functional assessments you've learnt in the other video. The global assessments, obviously. However, I tell you that this clinical reasoning of which I am talking to you right now is what has allowed me to really cure many patients, many with clinical cases, almost desperate ones, of which, of course, the only solution was...
It was the combination also of the two techniques.
Yes, I've always said, this actually is my approach to shoulder pain. Though what I was telling you, it was a very successful approach in most cases. Of course, I talk about patients precisely in desperate cases. I mean, where there was perhaps only been recommended a surgery as only solution, and that instead was solved through this global approach. That's why I tell you to think about these words and about my method, a bit particular to the painful shoulder.
If you enjoyed this video, please share it, like it, comment below, and subscribe to the channel. Review the link in the description to explore our courses and keep enhancing your skills. We'll see you in the next video.